You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to RN Mentor Podcast. Today I have a very special guest with me. I've known her for a few years and I had the pleasure of having her as a professor during my PhD program. And I'm very glad to introduce you to Dr. Eileen Frey-Bowers. She's currently an associate professor, nurse researcher, and associate provost for research administration at the University of San Diego. Dr. Frey-Bowers received her bachelor's degree from Loma Linda University School of Nursing, her master's degree from the University of Rochester School of Nursing, and her Juris Doctor from Whittier Law School. She received her PhD from UCLA School of Nursing with an emphasis in health services. She completed a federally funded postdoctoral fellowship at UCLA in the care of vulnerable populations, research with a focus on child health policy. She has also completed several additional professional fellowships addressing health law, regulations, and policy. Dr. Frey-Bowers is a certified pediatric nurse practitioner, a licensed attorney, and a veteran of Desert Shield, Desert Storm, having served in the United States Navy Nurse Corps. She has authored multiple journal articles and book chapters in seminal nursing and healthcare texts on advocacy, child health, and health policy. Dr. Frey-Bowers is a fellow of the American Academy of Nursing, and as of November of 2020, she will be the chair for the expert panel on child, adolescent, and family. She holds editorial board positions on the Journal of Pediatric Healthcare and Policy, Politics, and Nursing Practice. She was selected as a faculty policy fellow for the American Association of Colleges of Nursing and served 2 terms on Health Policy Advisory Council for the AACN. Welcome to the show, Dr. Frey-Bowers.
It is my pleasure to join you today. Thank you so much.
Thank you. Whenever I read some of these bios, I just realize how much I haven't done in my career. So thank you for everything that you do. You really have been a mentor, and I'm so glad to have you on the show. So much I've learned from you over the years. So I appreciate you being here.
Well, I'm just excited to be here. It's wonderful to see what you are doing now and how you are contributing to the current and next generation of nurses by sharing this information. So the pleasure is all mine.
Thank you. So I just want to start. So you are a fellow veteran, but you were in the nurse corps. How did you get started in nursing, and how did you end up on the military side of the house? Let's start there. How did you start in nursing? Let's start there.
I'm not quite sure how I started in nursing. Truly, I found my way to nursing. I'd always been very interested in science. When I was little, I lived in Ireland. I used to get a comic book it was called Twinkle, and it had a Nancy Nurse comic in the Twinkle comics. So I always was very interested in science and healthcare. But when I graduated from high school, I didn't really know what I wanted to do. I went to college, really had no idea, and I figured, this isn't going to last very long. I can't live on my parents' dime. I need to find a job. And, I was fortunate that there was a school of nursing not very far from Loma Linda University is not very far from the town that I grew up in Southern California. And I went ahead and applied. I was familiar with the academic medical center that they have. Due to some work that my dad had done there. And I found my way, and, it was, obviously it was a good step because it's been a great career for me over these many decades now. I graduated initially with a 2-year. This was back in the day when some universities offered an ADN. So I got my 2-year and started working immediately as a registered. Actually, I got my interim permit and worked, and then took the registered nursing exam. That was back in the day when they only offered it in February and July.
Oh, wow.
So that was quite a while ago. And I started working, and I continued with my studies to complete my bachelor's degree. I found my way to the intensive care unit. I worked at Loma Linda University Academic Medical Center. I worked on a unit called 8100, which is, to this day, I still think it's their surgical trauma ICU. I worked the night shift, and I spent about 2 years working there. It was at a time, one of those ubiquitous nursing shortages. So I advanced pretty quickly and became a night team leader, which was our terminology for a night charge nurse. I always thought that they were a little bit crazy letting somebody like me, be in charge of a very busy, surgical trauma ICU. But I also had always been interested in the military. I grew up in a military town. There was a very large Air Force base where I grew up. In my neighborhood, many of the children that I grew up with had parents that were in the Air Force. And then I had cousins that were in, different parts of different branches of the military they served. So it wasn't a strange idea to look into service in the military. After about a year and a half working in the ICU at Loma Linda, I was sort of like, I'm kind of ready for something new. I didn't go away to college. I had lived at home while I was in my nursing, doing my nursing studies. And so I thought, I'm ready for that adventure. And, the military became that answer. I had a really great experience. I connected with a recruiter who was just really a lot of fun. So she really made the experience enjoyable. She introduced me to another woman who was my age, who kind of had a similar background. She was actually from the San Diego area. She was, joining the Navy Nurse Corps at the same time. So we ended up becoming really good friends. We drove across the country together to officer indoctrination school in Newport, Rhode Island. And to this day, that woman and I are still friends and communicate. Nice. Facebook's a great thing for staying in touch. So it was, again, one of those kind of things where it was sort of, I'm just going to try this. And one of the other things that I wanted to do was move away from home. So I decided to go ahead and request being stationed on the East Coast. So I was stationed at Bethesda. At the time, it was the National Naval Medical Center. Now, Walter Reed and Bethesda are together in Bethesda. And true to form, the military took a surgical trauma ICU nurse and put me in a hematology oncology floor. Which, and initially I was like, what the heck, but I have to say that was probably one of the best experiences that I had as a nurse. It really taught me a different type of nursing. It gave me a whole new set of skills that I use to this day. In fact, I was answering a question earlier today that harkens back to things that I learned working on a cancer floor. That particular floor was co-run with the National Cancer Institute. So got a chance to be exposed to research protocols and things like that. So it was a very good experience. And you know how they always say, join the Navy, see the world. Well, along came 1990, and I got my chance to see the world. I did get deployed in support of Desert Shield and Desert Storm. I was aboard the USNS Comfort, spent my time on the USNS Comfort, and got to know, the Persian Gulf literally quite well, sitting out there in the middle of it. And had very interesting experience through that whole process. And then when I came back, I ended up working back in the ICU at Bethesda, and other things changed in my life around that time, and so I decided that I would leave my active duty role and pursue other opportunities. I got married and we moved, and I ended up in Rochester, New York.
Oh, very nice. So from a military perspective, and I get this question all the time, it feels like, just because we don't have that many people that have that military experience like we did, maybe a few years back. So how do you think the military contributed to your growth as a nurse or as an individual overall? How was that experience particularly different as a nurse compared to being on the civilian sector? Any difference?
Sure. I think one of the biggest differences is this idea that not only are you a member of the Nurse Corps, but you are a military officer. So you have responsibilities associated with being an officer that have nothing to do with being a nurse. And I think that's a very different experience from in the civilian sector. When I would go in every day, clock in and clock out, I'm on the unit, I'm expected to do a certain set of activities, caring for my patients, a certain knowledge set. Whereas, in the military, even when I was on the ship, there were days when, you're essentially the person that's in charge of everything for the day, and you have responsibilities that are associated with that. If there's an emergency, you are the person who everybody's going to come to. And it doesn't have to be a medical emergency. It could be something else, and you've got to problem solve. So I think that that's the biggest difference. There were, other things that I would get called upon to do. I remember one year when I was at Bethesda, this is post the Gulf War, this is when I was back in the ICU, I was put in charge of running the United Way campaign. So it's like tracking down everybody, all your colleagues, and, tracking them down and saying, hey, have you filled out your stuff for the United Way campaign? A lot of things like that don't happen in the civilian sector. You might have responsibilities, committee responsibilities that are associated with the hospital functioning, but it's not, these were other types of activities that were totally military related. So I think that I think is a good thing, because it allows you to develop other skill sets that we just don't really use or develop that much in nursing, or have the opportunity to develop in nursing, in generally in sort of a more traditional civilian sector of nursing.
Yeah, it has like those other skill sets, and I think a lot of civilian organizations kind of look for those additional skill sets when they hire a veteran. I think for that very purpose, it's not just the degree or the license, but they're hoping for that extra skill set, like leadership and being able to manage other things, because they presume that that's kind of what that experience is coming with you, hopefully.
Yeah, I would definitely
I think that's important. Agree. Yeah, I would agree also. So you left the Navy, pursue other things. Obviously, you moved forward with higher education. How did you decide you're going to go? You were like surgical ICU, oncology. How did you end up with pediatrics and become a nurse practitioner?
So that's a much more clear, intentional decision on my part. I realized, so when I was at Bethesda, the ICU that I worked in was a general medical surgical ICU, and Bethesda did not have a pediatric ICU. So children ended up in our, dependent children that were dependents and so forth, ended up in our ICU at Bethesda. And as a result of having this unique population in what was ordinarily an adult ICU, a select cadre of us were sort of put through a lot of pediatric intensive care training. And as I was doing that kind of training, I had this epiphany, like, wow, I really like this. I really enjoy this focus. And then, of course, taking care of the children when, they happen to be admitted, I really, I would sort of wake up, really excited to go to work. And, it just, I had a different sense about what I was doing. And along the same time, I remember, and I think it was, I'm not exactly sure if it was like a Nurse Week magazine or it was just one of those kind of newsletters that you get in your mail kind of thing. I got one of those at this time, and the profile that was covered in the magazine was about school nurses and nurse practitioners in upstate New York in the Rochester area. And I was fascinated by that story. And it just sort of opened my eyes to, I had not really been exposed to the nurse practitioner role. I knew very well the clinical nurse specialist role. I had worked with clinical nurse specialists at Loma Linda and, of course, in the Navy, but I didn't really know too many folks that were in the nurse practitioner role. I had a couple of other things that I read a book that was written by an economist. Her name is Sylvia Ann Hewlett. It was a book called When the Bow Breaks, and it talked a lot about our social policy in the United States and how we do or don't support children. And it was just this constellation of experiences and things that I was reading and being exposed to that really made me interested in pursuing greater education in the care of children. And my husband and I ended up moving to upstate New York, and I was very lucky that I was able to work at the University of Rochester and go to school there. And I was able to, at the time, it was kind of a hybrid program. This was before the days where we really had separated the NP and CNS roles specifically. So it was much more of an advanced practice program. And I did primary care as well as care in the hospital setting from a CNS type of perspective. But I got my master's degree in what was called care of children and families. And that sort of set me on my path that I've pretty much hewed very closely to for the rest of my, the rest of my career. I call myself a child health advocate.
Yeah, I've definitely seen that in your work. Just connected with you through social media and seeing the information you put out as primarily PEDS related. So I know that's where your advocacy work lies. So how did you, what did you do with that? How did you get involved in the advocacy role in addition to becoming a nurse practitioner to be able to be in that role? But how did you, I know you do a lot of advocacy work around that population. Like if somebody was going to get started in the world of advocacy, what's the pathway? Where do they start?
Sure. So, I have a sort of a different pathway than I would recommend for most people. I don't think everybody needs to go to law school. But I would say that while we talk about patient advocacy and so forth in our nursing education doesn't necessarily prepare us to work in the public policy space. You really do need to go and get additional education that focuses specifically on those unique skill sets. I happen to choose law, but there are other avenues. People can go and get, degrees in public policy. There's, the MPP, a master's in public policy. There are, in fact, I used to be the director of one. I was the director of a master's in public health in health policy program. So there are a number of other options in addition to law that people can take if they're interested in policy. But I do think it's important to recognize that that is a unique expertise and skill set that requires much more than what we are able to provide during our nursing education at all levels, right? Because, I mean, even, in a PhD program, while we try very much to help our students gain skills so that they can be advocates at that higher level, it is hard, on top of everything else that you're learning, to fit in some of the information that you might need that's specific to some of these the work that's required in the advocacy and public policy space.
Yeah. So how did you decide that like the law route was for you? Like what made you take that route?
So remember when I said I really didn't know what I wanted to do when I was in college? And part of the problem was I was interested in everything. And one of the things I was interested in back then was the law. My father was an immigrant, and when people ask me about my role models, my parents were really my first role models when it comes to higher education, because I saw both of my parents go through higher education as I was a child. So when I was an adolescent, I saw my mom go back to college and get her college degree. And when I was in elementary school, I saw my dad go to law school at night. He worked all day long and then went to law school at night. And so I had been exposed to legal education through watching my dad. And my dad happened to work in the biomedical industry. So there was sort of this overlap of health and law throughout much of, my adolescence and beyond. So it was always something I was interested in. And I was at a point in my career where I had been working in a number of capacities. I'd worked at the bedside. I had worked as a nurse practitioner. I had worked as a CNS in both inpatient and outpatient settings. And I think I was just maybe feeling frustrated that I'm having the opportunity to work with, children and families in a one-on-one basis, but there's so much more that needed to be done. I really wanted to impact things at a much more upstream level so that some of the issues that I saw at the downstream one-to-one experience could be impacted, maybe even ameliorated. So I decided to go to law school. Unfortunately, where I was located, I had limited where I was living and so forth. And I had 2 little kids at the time. I was kind of limited on how that worked out. But I was very fortunate in that I had the opportunity to get to know some fabulous legal professors where I went to school. And I feel like I got, just a wonderful education. And I got the opportunity to do a lot of hands-on child advocacy. I worked for a law firm that specialized in advocating for children and families. And so that sort of set me on my path. But I also, at the same time, missed the healthcare environment. I'm to my core, I'm an ICU nurse, and that, that's a hard thing to give up. Right. And so I found myself, finding my way back into the healthcare environment and trying to sort of see how could I combine my legal knowledge and experience with my healthcare experience while still staying as close as possible to the patient population that I really enjoy caring for. And I, through, again, a confluence of events, a colleague of mine, one of the physicians that I had worked with in the emergency department, asked me if I wanted to come join the School of Medicine at Loma Linda and do some work with him. And I was smart enough to say yes. And that introduced me to the academic environment. And from then I was able to at certain points in time, have appointments in the School of Medicine, the School of Public Health, and the School of Nursing. And that really gave me the opportunity to explore a lot of ideas, a lot of opportunity to work with multidisciplinary teams, folks from medicine, public health, local government, education. And that really taught me the power that the combination of all those, disciplines what they can bring to bear together, and that, no one discipline has, the single best answer, that we really do all have unique perspectives and gifts that we can bring to the table. And I had the chance, as I mentioned before, I had the chance to be a director of the MPH and health policy program. I got to, teach students who were in MBA programs and MPH programs, med students. It was, I think, as much a educational experience for me as it was a professional career experience.
Yeah, that's amazing. I think we don't see enough of that collaboration happen. We see a lot of energy being spent in silos. When you combine that energy, you can actually make some serious movement towards whatever you're advocating for. So that's fantastic that you were able to work in that environment. But you eventually decided you're going to go into research at some point. How did that kind of? I know obviously it was sort of an addition to what you were already doing, but how did you decide you were going to go into that program?
I was in academia and I drank the Kool-Aid. What can I say? It was kind of one of those things where I was like, well, if I'm going to use research to do advocacy work, I might as well understand how the research is conducted, what makes good research, what's bad research, and by that time I had decided that academia was probably a good place for me professionally, that it allowed me to it gave me flexibility that allowed me to explore lots of different things and work with lots of different talented people. And that's what I enjoy. So I decided to go back to school and get my PhD. And for those of your listeners who live in Southern California, they know what a challenge it is to hit the California freeway system. I think I know every freeway in Southern California and what time of day, it starts to stack up. I've got very, adept at traveling the freeway system as I commuted into Los Angeles to go to my program at UCLA.
And at UCLA, you had an opportunity to do you had a grant opportunity, mm-hmm. and you did a fellowship, mm-hmm. also.
Correct.
That was in addition to your PhD program? Was it part of your PhD program?
It was after my PhD program.
And how was that experience? How is that different than somebody who's in a PhD program?
So I completed my PhD program and then did the postdoc fellowship. And the postdoc fellowship was through the School of Nursing, but I negotiated with them the opportunity to work in one of the centers that UCLA has, which is called the Center for Healthier Children, Families, and Communities. And that actually arose through and I think this is like one message I want to put forward to your listeners and to anybody is never be afraid to ask for things. Never be afraid to put it out there. The worst that can happen is somebody says no, right? And can you live with that? If you can live with it, then, go ahead and ask the question. And
might as well ask.
Yeah, exactly. you really do have to be your own best advocate sometimes. And during my coursework for my PhD program, one of the things that I really enjoyed at UCLA was the fact that we had to take courses outside of the School of Nursing. Again, that emphasis on that multidisciplinary perspective. And one of the courses that I had really wanted to take was a child health policy course from a very well-known pediatrician researcher, Dr. Neil Halfin. And I emailed him about the course, and because I knew it existed, but it wasn't in the catalog yet. And I was trying to, schedule things and so forth. And it just wasn't going to work for me because I was still working, full time and everything as I was going to school. But I stayed in touch with him, and when the fellowship opportunity came up, I said, can I come be a fellow, at your center? And so we were able to negotiate my postdoc fellowship being sort of centered in the center. And it was really a very exciting opportunity because this was sort of shortly after the ACA was passed. And there were, and little, if you recall, for a period of time, parts of the ACA were being implemented. So, it wasn't like all at once. It was, at certain points in time, certain things would kick in. And so we were a year or two into that. And some of the things were starting to kick in that were starting to impact child health. And we don't really have a separate child health system in this country. We sort of fit children, these little square pegs, into the round hole of the adult health system. And so there were some things that we were noting that, there was potential, just created those sort of unintended consequences, right? Just that ripple effect, and it's not always foreseeable how the system is going to respond. So I had the chance to work on, at the time, what we called the Child Health System Transformation Initiative. And that brought together a number of experts from around the country. I happened to be one of the only nurses. It was mostly public health and medicine.
I was going to ask, how many nurses were at this?
Yeah, there was one other nurse who was involved in this project, and she was actually housed in a school of medicine in the East. But so there were a lot of things that we started to do in that response, in response to this, papers and pull together grant applications and a number of different things. And that particular initiative has gone on and has morphed into other initiatives funded by the Kresge Foundation, and wonderful things happening with the Nemours Foundation and things like that, supporting this development of thinking about how is it that we can implement upstream change to improve child health, and then how is it that we can address some of the challenges inherent in the existing healthcare system that don't meet the needs of children. So that was a wonderfully eye-opening experience. I had the opportunity to travel to Washington, D.C. on a regular basis, take part in conversations with policy leaders, and really get a chance to understand, not just the how a bill becomes a law kind of piece of policy, but all of the ways that policy is influenced through things at the regulatory level, through things like philanthropy and, the agencies and the kinds of grant proposals that they request, and all of those ways that we can influence policy. So it was sort of like a second degree in that, just, being exposed to all of that and being involved in those conversations. I was really grateful for that opportunity.
That's great. How important is the nursing voice in that environment of advocacy, and specifically in policy? Because we definitely don't have enough nurses involved with the policy end of the world. How important is the nursing voice, given your experience that you've had the opportunity to work with multidisciplinary teams, and you've spent some time in DC talking to policymakers, how important is the nursing voice?
I think it's extremely important, right? And again, it's setting dependent and that perspective is dependent on the setting in which you work. For nurses, we are the ones who are, in most cases, most with the patient population, whether it be a full community, whether it be, an individual patient and their family. I speaking from the pediatric perspective. If you're in the acute care setting, it is the nurse who is on that 12-hour shift 3 days in a row, 4 days in a row, with that family and really experiencing the course of illness with that family. If you're the nurse out in the community, it is, the nurse is a member of that community and experiencing what that community deals with in terms of access and other factors that might be influencing their health outcomes. I think we all wear different glasses based on what our discipline is. And, all those glasses need to come together to see the real picture. I don't know if you are, I love any kind of movies that have to do with history or sci-fi or anything like that. And I have boys. And so when my boys were younger, National Treasure, that movie was one of their favorites, right? And so there's a scene in that movie where he uses Benjamin Franklin's glasses to read the map. And it's not until all of the colored lenses are stacked up together to where the image becomes clear. Right. And I think that's the way working in a multidisciplinary team is. We all come with our colored glasses, and it's not until we bring all those visions together that we really can see that we really can assess all the different possible solutions, that we can, see the problem from different angles. And when you look at a problem from a different angle, then perhaps a new solution, arises if you've only looked at it from one perspective. So I think, nursing has a lens, and that lens, we need to share our perspective and be part of that collective solution. I don't think any one discipline has a single solution to improve, the situation for our communities.
Yeah. It's interesting that you mentioned that. Just not too long ago, I had one of my courses that was going through some modifications, and another college within the university said, "Well, that's a course that we teach at our college." I'm like, "Well, yeah, but this is a nursing perspective version of it. This is not, they were, and we went back and forth quite a bit, and I had to go back and make it more specific so it doesn't sound like their course. But I'm like, everything, our textbook, our perspective, the content we're sharing, the journals that we use, everything is nursing perspective. So it's interesting. So my next question for you is going to be, how do we do a better job as to put those multidisciplinary teams together and not have these silos of people working? Like another colleague and I are going to be putting a little program together again at the university where our college, we're using different faculty to come and talk about similar topics or like a common health topic, but we're bringing people from different disciplines to talk about it. But how do we do a better job as to putting those teams together? Because it seems like I see it all the time that it's this silo work and people just don't want to get out of their silos.
I think what you're doing is exactly the right approach. I think we need to make it, the normal, it's just like if you want to make something, you want people to do something healthy, you want to make it easy, right? It's the same thing. If we want people to work in teams, then we've got to start from the very beginning and make it easy. We need to make it part of the natural course of the educational process. So, oftentimes and I might not be very popular for, in some circles for saying this, but I think sometimes we get so focused on what our nursing courses must have all this different content, and it's very prescriptive. And we get so focused on making sure that they're memorizing the signs and symptoms of CHF and COPD instead of learning how to think. And I really embrace that. I think it's, if I can give somebody the skills, if I can help them develop really strong critical thinking skills, then I don't have to worry if their memory fails them, right? Because they're going to have the ability to, okay, let's go back to, let's assess, and go back and figure it out, because they've got really good critical thinking skills. And so I think it starts at the very beginning. It starts imparting the importance of the other courses that are not, the nursing course number courses. One of the reasons I decided to make sort of a shift mid-career from an academic health sciences university to a liberal arts university is for that very reason. I wanted the opportunity to not just have a multidisciplinary team that was composed of my other healthcare providers, but I wanted to learn from sociologists and, business people, economists and ethicists and, other individuals that the liberal arts environment provided. And I feel like it's been a wonderful experience for me. I've had an opportunity to collaborate on a number of things with my colleagues from the various schools at the university where I'm at now. And again, it makes me a better nurse. It makes me a better professor in the classroom. It helps me mentor others to see, these broader perspectives. Over the summer, all of the university put on a summer course. It was a 1-unit summer course. It was called Pandemic Times. And it was a 5-week course. And in each week, there were about 4 faculty members who ran the course for that week. And so myself and another nursing colleague joined colleagues from the College of Arts and Sciences, from the School of Peace Studies, from business, and we all brought a unique and different perspective to the pandemic. And so you had folks talking about, the ethics of care, but it was the perspective of somebody who studies ethics as a discipline, as not bioethics per se, but, ethics as a discipline. I presented on the impact of the pandemic on children. One of my colleagues presented on sort of the epidemiology of the pandemic. And, and so the individuals, the students who participated in that course really got a true multidisciplinary perspective on what was happening, with our current situation and COVID-19. I think that's how we change it. We help everybody see that the norm is to ask a sociologist about how they might handle this situation. It is to ask an economist for their perspective on how we might handle this situation. And it's to get that information collectively and then sort of come up with, the right answers. But I think that's a start.
That's great. That's great. I wish more universities made those opportunities available to students, because we see so many universities have like a certain track, and that's the track you stay on, and you don't get a lot of exposure outside of that track. So it's great that you were able to do that. Going back to your pediatric expertise. Given where we are in the world with the pandemic, with the current administration, everything that's going on in the world of pediatrics, where do you think, if you had to pick like maybe your top thing to talk about or advocate for from a pediatrics perspective, what would be where would that voice go to, sort of say?
Wow. Oh, golly.
There's just so much. I know.
Yeah. I would say, and actually, I would say child poverty. The child poverty is um, such an incredible stain on our country. The About 2 years ago, maybe last year, I can't remember the publication date, but the National Academy of Medicine released a report on child poverty and how we might tackle it in this country and how we might be able to reduce it in half in 10 years. And they sent, and it's called the roadmap. And they explicitly set out a roadmap. And, you know, it is within our ability to address this. We have, we have the capability. We just need the political will. And unfortunately, children are never a top consideration at the political level during an election. You don't hear any conversations about how this, how our children are doing in this country. You may hear a push for opening schools, but it's not rooted in the belief that that's what's best for the children. It's rooted in another belief. So I feel strongly that we need to do more for our children. I mean, it sounds trite, but they are our future. Their future is only as strong as the foundation that we help them build in childhood. If families are stressed, children are stressed.
Right.
Children are incredibly resilient, but that does not mean that they do not absorb the stress around them. That does not mean that they are not adversely affected by the traumas that they are exposed to. It takes a toll. And poverty is by far and away one of the worst experiences, because it sets a child up for so many other types of bad outcomes. A family that is under financial stress, you can have, stress. The parents can have stress that can then be transmitted to the child. There are so many other, housing instability, food and nutrition insecurity. Depending on how stable the housing is, then you have educational instability, because if they're not able to maintain housing, then the likelihood of them being able to maintain school attendance at the same school is and so there are just so many things that that come from child poverty that if we really wanted to do something to improve the well-being of children in this country, we would be serious about tackling the high rate of poverty in this nation in the pediatric population and the child population.
Yeah, and you're so right about that, because I know one of the first things when schools shut down, my wife is a teacher, so one of the first things we talked about is food. I would like so many of these kids go to school, and that's where they get at least 2 meals out of the day, and seeing things like long weekends or weeks off from school or anything like that. Now that it's been months, I'm so glad to see so many different school districts that have kept their food component open, so parents can pick up food for the kids and stuff. But it's still it's really is a shame when you see and I've been a little boisterous on this through social media, but like we spend so much money in like professional sports or doing things like that to keep them open. But then that same money could have so easily helped so many families during the pandemic. And but that may be a utopia. I'm not. I may never get to see where the money goes. So, but you're so right. I mean, childhood poverty. One of the schools actually my wife taught at, we know there was several families that were homeless living out of the car, but their kids kept coming to school on a regular basis, and we had opportunities to help some families out when we could. So yeah, you're absolutely right. It really is a shame that we live in a country that prides itself on wealth and that what's best for the people, but then we do have so many kids that are hungry and live in poverty. So yeah, you're absolutely correct. Anything else you want to share with our listeners? You're a wealth of information, so we could keep going. So anything else you want to share with our listeners with your current work or?
I will say, in looking back at my career and hopefully continuing to look forward in my career, I know, your podcast is called the RN Mentor Podcast. And I would tell people to definitely, seek out mentors, be intentional about seeking out mentors, and also be open to who your mentor can be. Again, for nurses, it doesn't always have to be a nurse, right? And I think that it's important to look to people from other disciplines, identify the kinds of skills that, you want to acquire and see who has those and look to them for guidance and, talk to them about how it is that you might acquire those skills as well. I think that, I also think that it's not always going to be a professional superior who can be a mentor. Again, depending on what you're trying to achieve for yourself, it could be somebody who is a peer professionally, but they may be an expert in another area or something. So I think being very open to who you can seek out for support, I think is really a good thing. As much as I've said, I wasn't all that intentional early in my career. I would say that being intentional has its advantages, and I am much more intentional now as I have gotten older. If there's somebody I want to get to know, I figure out a way to get to know them. I put myself in a situation where I can interact. If I go to a conference, I have goals to accomplish when I get to that conference. I think that having those kinds of plans for yourself are very important, and it also helps you feel like there are days when you might not feel like you're moving forward. And yet if you can accomplish some of those things, it makes you feel like you're moving forward. And I think we all need that, So I would say that to try to be, intentional. And I said before, be fearless. Of course, this is a bad question for nurses, but my husband always says, he goes, okay, whenever our kids would come home, and so upset or crying, his first question is anybody dying and is anybody bleeding? Okay, it doesn't always work that well with nurses, right? Because we know, but really, truly, in the grand scheme of things, particularly when it comes to, career and education and things like that, if nobody's dying and nobody's bleeding, and them saying no is not going to result in somebody dying or bleeding, then why not,
Right.
Ask, be an advocate for yourself. All they can do is say no. And then you say, okay, thank you very much. Appreciate you, considering my request, and you move on, and don't take it personally. They it could be a bad time for them. They may not have the resources, whatever. But don't take it personally. Keep moving on and keep moving towards your goals. I think is what I think that's probably the best piece of advice that I could offer people.
That's fantastic. I do actually live a little bit by that. But I also tell people, I'm like, go ahead and take that no, because you're gonna, and if you take that no, you're still gonna be in the exact same spot you were before. Yep. So you can only gain from asking, right? Yep. So great piece of advice. Thank you very much. Thank you for sharing your time with us. and wish you the best of luck. I'm definitely going to be keeping in touch with you. I think you're an amazing individual, and the work you're doing is fantastic. So thank you for
Thank you
being
so
on the
much.
show. Thank you.
Thank you.
You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.